if they have extra product that they're willing to sell you. So during the best times, when the market is sort of earliest on and there's the most demand relative to supply, you're at a major disadvantage if you only own retail. And you're also at a disadvantage if the market gets more mature and you're competing with these vertically integrated operators that can afford to make less margin at retail because they're making money on the manufacturing. If you only have retail, it's really hard to compete, from a price perspective.
What's up, guys? Welcome back to another episode of The Dime. I'm Brian Fields, and with me, as always, is Kellen Finney. And this week, we've got a very special guest, Jason Wild, chairman of TerrAscend. Jason, thanks for taking the time. How you doing today?
Good. How you guys doing this morning?
Doing well. Kellen, how are you doing?
Doing well. Looking forward to talking to Jason and holding down the West Coast. I think it's two East Coasters we have today, eh?
Yeah, Jason, for the record, your location is?
I'm in New York.
Nice. So another East Coaster, let the record state. So Jason, usually when we start, we ask our guests how they got into the space and kind of a little background about them. But I prefer to kind of switch it up today and ask more about, take us through a week, the different hats you're wearing, the different conversations and ideas that are going through that are on your plate.
Yeah. So in a given week, I run a fund and spend probably a good amount of my time on the fund, and then our largest position is where I spend another large percentage of my time, and that's by being the executive chairman of TerrAscend. I look at it as that it deserves. TerrAscend deserves 50% of my time because it's about 50% of the fund, and that's just sort of the way that it plays out. On any given day, it might be more of one than the other, but I would say on the whole, that's how I've been spending my time for the last few weeks. And what that means in terms of working for the fund is talking to investors, working on bringing in some potential new investors. In terms of marketing, although I probably spend a lot less time on that than most other fund managers do. And the other time on the fund side is just dealing with and keeping up with and interacting with the management teams at the companies that we're invested in or companies that we're looking at investing in. And then as it relates to TerrAscend, in any given day, it's going to be talking multiple times per day, talking to our new president and COO, Ziad Ghanem, just about things that are going on in any given day. For the last 5 days or so, I've been actually going down and spending a couple of hours at our brand new or newly opened for rec dispensary in Maplewood, New Jersey, and I've actually just been helping work the lines and help out there. And I just that's a great way to see the business in action and just know a lot more about what's going on. Other things that I do for TerrAscend are I'm very active on the M&A and business development front in terms of talking to new companies, finding new companies for us to potentially acquire or partner with, and that there ends up being some connectivity between. There's a lot of companies that I meet through the fund, and if I think that they'd be an interesting partner or acquisition for TerrAscend, I will usually flip that over and sort of put on my TerrAscend hat and see if there's something that we can do there. So it's a lot of it is sort of borders over into sometimes I'm doing two things at once, I guess.
I love it. So let's stay with TerrAscend. Can you kind of give us an overview about the company and kind of value it brings to the space?
Sure. So the company, I originally invested in the company back in the end of 2017. They were actually a Canadian LP, like the Canopies and Tilrays of the world. We led a $52 million investment, private placement into the company, which actually Canopy Growth co-invested in that deal with me. And I became the chairman. This was back at the end of 2017. At that point, on the fund side, we were only comfortable investing in Canada. So we assumed that TerrAscend would be, that we would run it and just look for deals in Canada and everywhere, essentially not in the U.S. because it was illegal, federally in the U.S. About 7 months later or so, we decided to pivot the company into the U.S. It was right when John Boehner went on the board of Acreage, and I said, if they're, if they're going to arrest anybody, they'll arrest him before they before they arrest little old me. So we decided to move into the U.S. Our first acquisition was the Apothecarium dispensary chain in San Francisco, which is considered by many to be, sort of the first of the really nice dispensaries and out there in California, and still, some of the nicest dispensaries. So we acquired that in the spring of 19. That's when essentially TerrAscend entered into the U.S. A few months later, we acquired one of the largest operators, cultivators, and manufacturers, and retailer in Pennsylvania called Ilera Healthcare. Also around the same time, or a little earlier, TerrAscend had applied for a license in New Jersey in the summer of 18. And we actually came in number 1 or number 2 by score out of 150 applicants. So we got a license for the northern region of New Jersey, which is, believed by many to be the best region of Jersey because it has the most people and the biggest part of the economy. So those are the main states where we are now. Oh, in addition, recently, TerrAscend acquired Gage Cannabis, which is one of the top operators in Michigan, and that was about a $450 million deal. So that is another large, asset of ours. Our approach, which has been different than I think most of the other multi-state operators, is that we decided, 3 years ago or so, that we didn't want to just have lots of flags on the map and be able to say that we're in, 25 states or 20 states. Our belief was always that the best way to build the best business is to be focused and only really enter a state if we think that we can be one of the top, 2 or 3 players in that state over, some short time period. And we felt that would afford us the best margins because we build more scale in less places. And also it just give us the best chance of being successful because, if we're in 4 or 5 states, which, where we are now, we're in 5 states, and we're competing with another operator that's in 15 or 20, we think that there is, an inherent advantage. The other reason we do it this way is because our view is that if and when these states get more competitive, especially the limited license states where we have most of our operations, our view is that when they got more competitive, there might be a price at which a grower that's only in 15 or 20,000 square feet of canopy, they can't turn a profit. But if we're one of the most scaled operators in the state and we have more like 100,000 square feet of canopy, that we will still be able to have a sustainable, profitable business. So that's been the main. I think that's been the main difference. We've also been, very what's the word? I don't know, picky in terms of acquisitions. We've stayed away from the acquisitions that are, like of all the other, say, multi-state operators, because that would just sort of go against the whole strategy that I just mentioned of trying to be focused. And our view is that we'll do best, and we'll be able to build out the map for ourselves over time. The best way by going in and trying to pick, from the best operators in each specific state, like more, essentially buy different single state operators, and we feel like that's the best way to build the strongest footprint.
Yeah. I want to get into a little bit of the nuts and bolts of the business. So TerrAscend is vertically integrated, meaning that it operates in every sector of the supply chain from seed to sale, if you will. So what aspect of the cannabis supply chain do you believe your organization is the strongest at right now, Jason?
Good question. I mean, I look at it as, pretty much there's cultivation and manufacturing, and then there's retail. And I don't want to come off sounding like arrogant, but I feel like we've really focused a lot on making sure that both of those sides of the business are the strongest that they could be, that they don't sort of depend on the other side of the business. So, I mean, I think our apothecarium dispensary chain, which is now, we have 5 in California and 6 in Pennsylvania and 2 going on 3 in New Jersey. I truly believe that they are amongst the best, dispensaries in the country. And when it comes to cultivation and manufacturing, I feel like we are very strong there because we've focused on it, and we really, really, have we place high importance upon making sure that we produce the highest quality flower that we can. And that's easy to say. It's a lot harder to actually do. Growing cannabis, especially when you're trying to grow amongst the best cannabis in the market, it is very, very difficult. And there are, there's tons of horror stories out there of different grows that have had different issues. And I can tell you firsthand that it's a really tough thing to do, to grow cannabis that sort of the true connoisseurs think is great. But we think that is the most important part of the market. In my view, like the 20/80 rule as it applies to cannabis is 20% of the people buy 80% of the cannabis. And I would say that the majority of them are high quality, they're connoisseurs of high quality indoor flower. And that is really the consumer that we are looking to appeal the most to, because they're buying 80% of the product, right? So that's what we've done on the cultivation and manufacturing side, and I think that we're among the best at that, but always looking to get better.
What's your favorite portion of the supply chain?
What's my favorite? I love the cultivation side. I just love, I remember the first time I ever went out to a grow up in Canada back in 2014, just like the smells just like hitting me like a ton of bricks when I walked in. And ever since then, I go out to our Jersey facility, I'm out there at least every week. And every time I walk in the door, I still get the same feeling when that smell hits me in the face. So I love that.
That's incredible.
I want to stay on Jersey. I saw you say that when there was a pause between the announcement that TerrAscend won the license, I want to know what that feeling was like in that pause, and then what you felt emotionally after they announced TerrAscend. And then expanding on that, what's the next step? Take us inside that room. Is it, how do we deploy New Jersey and get everything ready to go? Or are you focused on Maryland, Michigan, and other states for expansion opportunities?
Sure. So I'll tell you, inside that or on that call, it was interesting. They had already gone through like the other 6 operators that they approved, and the process was, I believe, that the chairman would state the name of the operator and say, "I have a motion to approve," and then somebody would come on. It must have already been chosen who was which other commissioner would say motion to approve, and then they would vote, and then they got the TerrAscend, and we felt really good about getting approved, even if it was a smaller number than 7. Ended up getting there, and they said the TerrAscend, and the chairwoman said, "Do I have a motion to approve?" And nobody said anything, and it felt to me like it must have been 10 seconds. It felt to me like I was like I don't know, everything froze. I went through all these emotions. I was like, did my line just die? I wanted somebody to jump in and say something, but then it meant, at some point, if they said something, then it meant that it wasn't just my phone that died, which I was almost hoping was what happened. And it actually even took me, to tell you the truth, it might be a little insight or feels like a little bit of a therapy session here talking about it, but it actually took me back for some reason to high school and feeling like everybody went out and went to the party, and they left me at home, and I was still sitting there waiting by the phone or something like that. And all of that happened in 10 seconds or so, and then the chairwoman repeated it again, and somebody came on and said, "I make a motion to approve."
It's got to be just overwhelming joy knowing the types of investments that went into it, the emotional investment, And knowing that obviously the East Coast is a massive opportunity. And exactly like you're saying, if everyone else is kind of planting their flags there, that's definitely where you want to compete. So staying on that, after it's approved, are you looking for other opportunities? Like, take us through the strategy for you and the role you play there.
Yeah, absolutely. So New Jersey, I mean, what I was so excited about is that we have been spending, we spent, about $40 billion over the last 3 years or so building out our facility. We didn't know originally that it was going to go, that rec was going to be on the ballot. That was obviously a huge positive for us when that happened a year and a half or so ago. And we had been ready, and we thought the program was going to launch, in the second half of last year. So, and we were, building up supply and it's like every time it got delayed, even though we, knew sort of intellectually, we knew that it was going to come at some point. It's like, it almost felt like it was, never going to come, or I wasn't going to believe it until it actually happened. So having that vote was just a huge relief. And it ended up being, it was a little bit, I guess better than expected, because we were going to be able to launch within after that vote, we launched, I think 8 days later or something like that. Originally, there was supposed to be a 30-day notice period, and that's when we were going to go be able to tie up all the loose ends and be able to, manufacture at. You don't want to manufacture everything to be ready, because if it gets delayed, then the product, could expire and all the rest. So we originally thought we were going to have 30 days to, run 100 miles an hour, but it ended up that it was going to be 7 or 8. And Ziad, our new president, and the team really pulled together. They did, daily meetings about what they needed to do to be ready. And we opened up last Thursday, and awesome. It's been as amazing as we thought it would. We had worked on lots of different scenarios, things that could go wrong, and we knew that some things would just pop up that we hadn't thought of necessarily, but it actually, knock on wood, everything went really well and came off without a hitch. And I think part of it was, being out there, which is what's been, so amazing, is like I don't know who's more excited, our staff out there or the customers that are coming in the doors, because it's not like, on the West Coast, so tons of people have already been to legal dispensaries, but on the East Coast, the majority of people have not, and you just see them. They can't see into the dispensary from the outside. So you see them walking through the door, and they get through the doorway, and their eyes just sort of get big, and they're just so excited. And everybody is everybody's been in a great mood. We've been able to get we've had long lines, but we've been able to get people, through the doors and past the registers and all that really, really quickly. I mean, I think we were pumping through 1,000 patients, not patients. I'm still thinking of medical. 1,000 customers. Per day at the dispensary where I was working over in Maplewood. So I'm going to that's a huge opportunity for TerrAscend, because we don't have, back to our strategy of not, wanting to go deep, that we wanted to go deep and not wide. We don't have a big footprint. And so New Jersey, where, we aim to be one of the top, 1 or 2 players, it has so much more of an impact on our numbers, and we're so much more leveraged to Jersey than all of the other operators that are out there. So I have definitely been focusing, even after the approval, focusing a ton of my time and attention there. But like being in this business, you have to keep a lot of balls in the air. And certainly Maryland, we are building a large scale facility down there that should be done, or it should be operational at least in the late summer of this year. Hopefully. Rec will be on the ballot in Maryland. It looks like it will be. So that could be a state that turns rec, say, sometime next year. Pennsylvania, where we have our largest current facility, there is a lot of talk that will be going rec next year as well. That'll be done legislatively, because I think they can't do it with the ballot. But you got to you still have to focus on all aspects of the business, even though New Jersey is now generating, many multiples per day or per month versus what it was under medical. We still have to be able to pay attention to the other places, and we're still, and that's what we're still doing. I think I think that it's going to be, our portfolio. What excites me overall about our portfolio is that it's sort of like, if you look at it like a NBA basketball team, because we have all of these states that are medical going to rec, and in Michigan we have Detroit still hasn't gone, even though the state of Michigan has gone rec. Detroit has not, and we have stores there. But in terms of Jersey, PA, and Maryland, it's like, to me, those are all states that are medical, or in the case of Jersey where you can eat while you dream under the medical program, and make good money. And then when rec comes, your business hopefully goes up 4 or 5x. So I sort of look at it as our portfolio is like a team of first round draft picks that are that they're going to have a huge future, and they're awesome now, but that they're going to be even better in 5 years. And you compare that to a lot of the other footprints of most of the other operators. They have more assets, or they're in more states where it's already gone rec, which means that sort of by definition they're already the most mature markets. So that's very exciting to me. I feel like we have a very long runway of growth for many years.
So from a strategy standpoint, the medical dispensary aspect of entering a state has to be huge from managing manufacturing and production, right? Because I was just thinking of like the dialogue that goes on with the state when they have to tell you exactly the date that they're going to let recreational sales go through. Because cannabis doesn't grow overnight, right? Like you guys have to take weeks and weeks to grow it, to prep it, to get it tested, all these other things. So what is that dialogue like, and how beneficial is it to be in a medical state operating to manage that manufacturing aspect before it turns rec?
Yeah. So, I think being in these programs under medical certainly gives you a big, I think, leg up, because also in most of these states that, the first ones that they let operate as rec cultivators or stores are the medical operators. So that's definitely the best position to be. In terms of Jersey, we had I think we had like 4,000 or 5,000 pounds of flour, in our vault waiting for rec. We have gummies there. We have our Valhalla gummies, which is our California brand. We have them out in Jersey. They're actually called, we're not supposed to call them gummies. I think they are called soft lozenges under the medical program. But then there's differences between like the new rec. I think those could be called gummies. The new rec gummies have to have like an imprint of like a warning sign in the gummy. So like that's actually why we haven't launched our gummies yet, because we just got that imprint a couple of weeks ago. We had to go get the mold made. I think it was made in China, and I believe it's at a port in maybe in Newark or something like that, being taken. Supposedly it's going to get delivered today, and we'll be able to launch with our gummies. But the whole thing with all of these, these are super complicated operations, and the timing has to be just right in terms of scheduling when you're production and all of that. But that's what's exciting to me, because if you're if you care more about that than your competitors do, or you have better people who are good at navigating complicated processes, then that's what gives the better operators a leg up. If we have hopefully we'll have we're going to be launching our concentrates line in Jersey hopefully next week. So that would be live resin vapes and butters, batters, and shatter and all that kind of stuff. We think we will be the first ones on the market. If we do, that will be huge for us, because we're only going to really sell them in our own stores in Jersey, and that's going to pull people from all over the state. Those are the kind of things that sort of get me excited, because it's just a matter of like everybody doing their job the right way, and then things come together and put you at a big advantage out in the market, especially in the overall the cannabis space has or growth in cannabis has slowed down a little starting last June, when people started leaving the house, and they had other things They had other things to do other than sit at home and smoke weed, and they had other things to spend money on than that, like going to restaurants and things like that. So in what's not as easy of an environment as it was a year ago, when all the companies now don't have the wind at their backs, what excites me is if and when we do things when we can do things a little bit more efficiently, like that's the way that you build the great brands. Like in my view, the great things happen when you're going through tougher times, not when everything is easy for everybody. If that makes sense.
Right, fuels innovation too.
So staying on Maryland, right? Based on the location, is that like a key strategic move in understanding its location to the other East Coast markets? And the demographic kind of resembles similar Pennsylvania. So is there interest to speed to market to get there, or is it more of placement in the opportunity? Can you kind of shed more light on that?
So Maryland we bought a smaller grow. Curaleaf had to divest a cultivation facility because they bought a grassroots. You're not allowed to have two. So we bought that. It was a good deal based upon the revenues and profits that were coming out of it, but it was not the size of facility. I mentioned earlier that we want to always aim to be the top in the top 2 or 3 in a market, and this facility is a smallish facility, but we got it for a good deal in terms of the business it was doing, and really we also looked at it like we were buying a piece of paper that we can take and go out and build a much larger facility and have it attached to that license. And we entered Maryland last year through that acquisition with cultivation and manufacturing only, not with retail. So we're not currently vertically integrated in Maryland. And our view was that there's a 4 dispensary cap in Maryland. Maryland's a little bit more over dispensaried than other states. Like they have, I think they have like around 100 dispensaries for 6 million people. Compare that to Pennsylvania, where there are I want to say 135 dispensaries for over 12 million people. So a little more over dispensary, meaning an average dispensary does, probably 3 or 4 million in sales versus, 7 or 8 in some other states. And we felt like we didn't need to be in a rush to get to own the dispensaries because the real prize was going to be rec when that came. And we just felt like we wanted to be there by then. So that's what that was the approach we took when we entered there. We just announced a few weeks ago that we're buying our first dispensary it's called the Allegheny Medical. It's cool. I hadn't really looked at the map of the U.S. I don't know, closely, I guess, or understood that Maryland has a weird shape. Like the northwest corner of Maryland is like super, super skinny. And that's where Allegheny Medical is. I believe it's within 6 miles of 3 different states. So if Maryland goes rec when we think it's going to, and we think that it's going to be before most of those other states that we border on, we think that that's an amazing location. And we're in discussions on multiple other dispensary acquisitions in Maryland so that we can get ourselves to that cap of 4. And we think that we'll be there by the time that rec kicks in. So that was the approach we took in Maryland. I guess the point is we want to be vertically integrated, but it doesn't always work out that way where you can get it all in one fell swoop. And we will enter with cultivation and manufacturing first, but we will not enter with retail first, because if you're a retailer in an undersupplied market, you're always going to be at a disadvantage because you're only going to get product from the other players that are vertical if they have extra product that they're willing to sell you. Yeah. So during the best times, when the market is sort of earliest on and there's the most demand relative to supply, you're at a major disadvantage if you only own retail, and you're also at a disadvantage if the market gets more mature and you're competing with these vertically integrated operators that can afford to make less margin at retail because they're making money on the manufacturing. If you only have retail, it's really hard to compete, from a price perspective.
Yeah, and I think manufacturing, you can create more revenue streams from like tolling and other opportunities too that create a better, a more stable business from a startup perspective.
Diversified business too.
Yeah.
Oh yeah, 100%.
When the industry becomes global, do you see overseas being a challenge, let's say, for mass production and cultivation?
Uh, no, I don't think so. I don't see that happening anytime soon. And I don't think that, like high quality flower, there's no reason to grow that, or there's no cost advantage. Let's just talk about US. People ask about, interstate commerce and all that, right? And that a lot of this stuff's going to come from California. But there is, that's because California has, sort of perfect weather conditions and all of that. But there's no advantage to growing super premium indoor flower in a warehouse in California and shipping it, say, to the East Coast. So our view and for a lot of other reasons that we think, high quality premium flower is the way to go. But our view on interstate commerce is that would be the least impacted by interstate or sort of global commerce in the cannabis space. I don't think it's going to happen anytime soon though, where you have product coming in from overseas. I mean, even in terms of pharmaceutical prescription drugs, like any controlled substances, generally need to be made in the U.S. You can ship in API or the active pharmaceutical ingredient, but you can't ship in, manufactured product into the U.S. And I think that would probably remain the same or be similar if cannabis was legalized.
With your pharmaceutical experience, what can cannabis operators learn from, let's say, the technology for real-time process control to, let's say, ensure a clean product to avoid recalls and other concepts like that in the future?
Yeah, I think that overall, people from pharma, what I find about when I run into or when I work with people that came out of pharma that are in the cannabis space, there's just often a little bit of, or there's more of a focus on quality and safety. There is, like if somebody comes in from real estate or something like that, they don't. I find often those companies have less of a culture of compliance and of quality. So I think that overall, there's tons of things that having more pharma experienced people in cannabis where it helps, because these are essentially pharmaceutical manufacturing plants. It's just that they're also growing live plants. But there's a ton of advantage to having people. We have multiple people at all of our facilities that came out of pharma because they just understand the science better. But I think that varies from company to company.
I have a quick question. So traditionally from a manufacturing perspective, pharma has a different set of guidelines they have to follow, right? From a CGMP perspective. And nutraceuticals kind of have their own rules that they follow.
Yeah.
Do you think that there's going to be that hard line in cannabis from a recreational and a medicinal standpoint? Or do you think that they kind of should all follow the same manufacturing guidelines?
Yeah, I think they'll all fall under the same guidelines for as long as the FDA doesn't take control of of regulating, which I don't see that happening anytime soon. But in the meantime, I think that they will stay the same because the states are going to be the ones that are in control of the licensing, and these are the programs that they've already laid out. Whatever the medical program is, I mean that's you're following the state rules, and it will. My view is that it will remain that way in the future, even if we have legalization.
When you started your journey in the cannabis space, what did you get right? But most importantly, what did you get wrong?
What did I get right? I got right that that there's huge demand for this product, that more and more people were going to be consuming it over time, and therefore this industry had the wind at its back from a growth perspective, especially relative to regular pharmaceuticals. What I guess I got wrong was, I mean, we did really well in for the first 4 years. We only did Canada, and my view was that was going to be the only place that would be able to attract institutional investors, and therefore, the stocks would would do better than the U.S. ones, and that worked really well over that period of time, say from like 14 to 18. I guess maybe in Canada we outstayed our welcome a little bit too long. Like once I realized that the Canadian market and the structure of the Canadian market was not conducive to being able to have a strongly profitable company, I probably stayed a little bit too long. But that was probably a mistake that we made. As I mentioned, we did pivot into the U.S. Starting in 18 and 19, and I think that was definitely right. I mean, it's like the U.S. is the best market in practically every market. The U.S. is the best in terms of the revenue potential and things like that. That's definitely the case in cannabis, and I think that the fact that we were the only Canadian LP that pivoted fully into the U.S., which we had a choice to make. Some people thought we were crazy because we were going to be giving up being able to be listed on a U.S. exchange, if we were actively involved in the U.S. But to me, that was a no-brainer. It's like the whole. I told everybody at Terrace on the first day after we made our $52 million investment a couple of years earlier that I think it's a Warren Buffett quote. Long-term, the market is a voting machine, and I'm sorry, short-term, the market is a voting machine, and long-term, it's a weighing machine. And the only way that we're going to get paid is if we build something that weighs a lot. And to me, going into the U.S., that was building a company weighing machine and knowing that we can build the best business that we could.
We're sitting here a year from now. What has your team accomplished?
New Jersey will be, a huge driver of our business 1 year from now. Hopefully, we have 3 stores that are, run rating in Jersey at over $40 million in revenue. And, we should have a strong wholesale business selling to the other operators in the state as well. We will have finished our expansion in New Jersey in terms of our cultivation expansion, where we're going to over double our footprint there. So that'll be in Jersey. Maryland, rec will have started or be about to start, and we'll have completed that facility and be fully ready to be one of the top players there in that market. And Pennsylvania will be ready for rec as well. I mean, we have like 3 huge drivers coming up over the next year. Gage will be much larger than it is now. There's some amazing deals out there for small mom and pop dispensaries for like low single digit EBITDA multiples. So maybe Gage will go from 17 dispensaries right now to, I don't know, closer to 30 or so. And the main thing is to just continue to be one of the best companies in the space from an operational perspective. Our view is we don't necessarily want to be the biggest cannabis company in the country. We want to be the best cannabis company in the country. And if we're the best, there's a good chance that at some point we're going to be the biggest as well. Not necessarily by next year, but I got like a 20 year time horizon.
Let's do a quick rapid fire. Product category you're most bullish on over the next 5 years?
Flower.
Psychedelics as a medicine, yay or nay?
Yay.
Under the radar state you have your eye on?
I can't. If I talk about it, then it might not be under the radar anymore. But figure, there's a basket of them. Figure all the states sort of east from Michigan going east towards New York, and then up and down the East Coast. There's a bunch of good opportunities there.
That's fair. What mega policy causes more disruption in the cannabis industry? Federal legalization or interstate commerce?
Ooh, federal legalization.
That one's tough.
Because I don't think interstate commerce would be phased in. If we have legalization, from the people that I've spoken to, interstate commerce would be phased in over a 3 to 5 year period.
With your experience and relationships in this space, what is one area of the industry you think is completely untapped that eager entrepreneurs should consider to enter?
Cannabis, the technology side of cannabis, whether it's software or hardware in terms of grow systems, things like that. Things that are actual major improvements and that are best in class products that can help the industry be more profitable.
The biggest misconception since you've been in the cannabinoid industry?
Biggest misconception, just overall, that I think this is all changing, but that people that are cannabis consumers, that they're lazy and unmotivated. The people that I know that are in the cannabis industry, and especially the ones that also consume cannabis, I find them to be some of the hardest working, most some of the most principled people that I've ever met, and extremely creative as well.
Before we do predictions, we ask all of our guests if you can sum up your experience in a main takeaway or lesson learned to pass on to the next generation, what would it be?
Not around cannabis, just overall.
Life lesson.
Life lesson. Patience. You don't need to go at, you don't need to be in your job. You don't need to be a huge success within 1 year or 2 years or 5 years. It's a long road. I've been running my fund now for 22 years. We started with 80 grand. And we didn't hit $1 billion in AUM until, 20 years later. So I think the more patient that you could be, the more successful that you're going to be. And it's sort of one thing I would add to it. It's sort of like, don't be focused on that you need to make a lot of money. Be focused on being great at whatever you're doing. And then the money is the byproduct of that.
That's really well said. All right, prediction time. Jason, the cannabis industry is fighting battles across multiple fronts between banking, stigma, and regulations. What negative scenario or event keeps you up at night?
Oh, what keeps me up at night? Nothing. I think things can't really be worse than they are right now in terms of things that sort of act as roadblocks all the time, like having to do everything within a state and all of these different regulators and things like that. Like we're at maximum a maximum level of difficulty right now, and I actually think that things get better in the coming years. So back to what I was saying earlier about tough times making you stronger. There's a quote that I had read a few weeks ago that I thought was really good. I don't know if I can get it right, but it's something to the effect of hard times make strong men make good times make weak men, and weak men make hard times. And I think that we're right now in the, it's all a cycle, I guess. I think we are in the now where it's hard times, are going to make strong companies. And then, there should be some good times ahead, I guess, before things before we screw it up. But that over the course of 20 or 30 years, I think that we're, nothing really keeps me up at night other than just like, sometimes I'm going to bed and I'm like, oh crap, I forgot to call back, X, Y, Z, like just having a million things to do.
Sure.
But there's nothing that keeps me up at night from a, anxiety point of view.
Kellen?
It's a tough question. I would probably say just global events that deter the attention of our politicians from pushing like federal legalization and banking through from legislative standpoint. They have other things they're worrying about, unfortunately, right now.
Yep. Yeah, I agree with that. I mean, it's that's sort of, I don't know if that's what keeps me up at night, but it's just sort of, it makes me sad that so many Americans are supportive of cannabis and that we just can't, in this country, we don't seem to be able to get anything done federally. That definitely makes me sad.
It's crazy.
I'm more fearful of like another vape gate opportunity. I think something like that with like the negative stigma that comes with it. It's just such another challenge to an industry that's kind of facing like challenges on all unprecedented levels. So concepts like that kind of give me concern because it kind of hurts the industry as a whole, even if it doesn't have anything to do with, let's say, some of the bigger operators or some of the players that are doing things the right way in the space. And I think what we need right now is less of those like distraction techniques that hurt the politicians and the concepts, and less of our friend Governor Ricketts saying that if you legalize cannabis, it'll kill your kids, and more people like yourself, Jason, that are championing like the industry and then the positive benefits, and hopefully some more of this research that comes out that allows people to kind of remove that stigma.
Yeah, I agree with that. I absolutely agree with that. I guess the offset of that is, there could be another vape gate or something like that. But I also think that there's a good chance that in the coming years, we have data start to come out that about, even more of the benefits of cannabis. Like I believe that not only is, say, for cancer, not only is it good for palliative care, but that I think there's going to be some studies that come out that show that cannabis actually has anti-cancer and anti-tumor properties. I think if we start seeing more of that data, that like I almost feel like there's a better chance that happens than that we have another vape gate. Or I hope that's the case.
Yeah,
I mean that's what the clinical trial in Israel is for, right? They're showing that one strain is very effective against a specific type of cancer.
Yep. Absolutely. Glioblastoma. There's a study.
Yeah, I was trying to think of it, and I was going to fumble over it. So I'm so glad you remembered the name. I was like, what was it again?
Yeah, and that is like at the drug company that I mentioned earlier that we sold. We had one of the only approved products for glioblastoma, and because it's such an unmet need, it was there wasn't a real high hurdle that we had to get past. I think we had to show that we extended life by 30 days or something like that, which is not the best. But at least what I saw, I haven't seen any data recently, which concerns me. But a couple of years ago, I saw some the data from the phase 2 trial that what's the company in the UK that got sold to Jazz? I'll think of it in a second. They had a glioblastoma trial where it was like half THC, half CBD, and compared to the standard of care was 350-day average. Life expectancy, and the cannabis arm was 550 days.
Oh, wow.
And that's pretty
so
powerful,
huge. Yeah.
especially for such a tough type of cancer to treat. So
was that GWB? Or
GW Pharma, that's who it was, exactly.
Pharma, yeah.
But I haven't heard much about it in a couple of years. So sometimes when that happens, it means that, the phase 3 didn't go quite like the phase 2 did. But we're going to, I believe we'll start to see other data in other, disease states that shows, the benefits as well.
So Jason, for our listeners, they want to learn more and they want to try some of TerrAscend's products. Where can they find them?
Sure. Northern California, we have three dispensaries in San Fran, one in Berkeley and one in Capitola. In PA, we have 6 scattered. I can't name all 6 locations, but scattered around Pennsylvania. And in New Jersey, we have one dispensary in Phillipsburg, which is on the western edge of PA. And we're actually like less than 100 yards from the bridge that goes over to Bethlehem, Pennsylvania.
Nice.
So amazing location for a rec or for anybody in PA that would want to come over. And our other location is in Maplewood. And we're going to be opening our 3rd location in Jersey. Is we share the parking lot with the Bada Bing from The Sopranos. So we have very high hopes for that site. It gets like 220,000 vehicles per day that drive by, and everybody knows pretty much. You ask them if they remember the Bada Bing from The Sopranos, and everybody sort of remembers it. That'll be our 3rd location, and then in Michigan we have 17. We have 17 dispensaries, pretty much covering practically the whole state. So those are our locations. Those are the ones in Michigan are branded as either Gage or Cookies dispensaries. And then all the other ones are apothecariums. And we also have a Cookies dispensary that we own in Toronto.
I visited that facility. It's an awesome facility, and the people there are awesome. So appreciate you taking the time. Thank you so much, Jason.
Thank you. Thanks, guys.